Hi everybody, I'm Dr. Bethany Powers. I'm here at Ward MD Institute talking to you today about facelifts and neck lifts. So who is a candidate for a facelift and who's a candidate for a neck lift? Oftentimes they go hand in hand. So patients oftentimes are coming in and they're disturbed by jowling that can happen, where we see descent in this area, or a lot of our patients are coming in and they say, I don't like the waddle under my neck. And those types of patients are oftentimes going to be candidates for a facelift and a neck lift. It depends on your anatomy, it depends on your overall health habits, and it really depends also on your age and your genetics. So sometimes patients are even a candidate for a facelift and a neck lift at around age 45. And sometimes really we don't see a lot of that descent or that jowling or that waddle that's forming under the neck until they're kind of aging into their 60s. If patients are coming in and they're a little bit younger, so say they're in their 20s or their 30s, oftentimes those patients may not need a facelift, but they might be talking about some of the submental fat or the fat pad that lives underneath the chin. If those are the patients that we're seeing, we oftentimes will talk to them about facial contouring, which is where we go in and we sculpt the fat that's under the chin, and we also perform liposuction at that time. Patients that are a little bit older, maybe in their 40s, 50s, or 60s, oftentimes don't just have a fat pad underneath their chin, but they also will have some skin laxity or also muscle that has started to separate. And if that's the case, those patients are a candidate for a neck lift. So my experience with facelift and neck lifts are that patients oftentimes are really happy with their results because we do them hand in hand. It's one recovery. It's an incision that's placed around the hairline, up onto the ear, and then around the earlobe and back to the hairline. With that incision, we're able to accomplish your facelift as well as your neck lift from the outside. And then it's also paired with a small incision that's placed directly underneath your chin in that small crease that we all have there. Those three incisions, so one on each side, here, here, and here, really allow us to go underneath the skin, tighten the muscle that's there, which is called the platysma in the neck, or the name of it's called the smaz up in the face, and we are able to give you a restoration. And what I really typically am trying to aim for is that we're not pulling the skin tight. We're not saying, hey, we're gonna make you look like you've been windswept. We're really going in and reestablishing where that muscle layer and that fascia layer should live, and then just redraping the skin. The goal of a facelift and a neck lift is to make you look rejuvenated. We're never gonna be able to say, okay, we're taking 30 years off of your face. But that being said, we're going to be able to reestablish where those structures used to live, and we're going to be able to make it so that you don't look windswept and you don't look overtly pulled, but you look really natural. How long does a facelift typically take? So it depends on your anatomy, it depends on how complex your specific structures are, but anywhere between 4 to 6 hours. Patients come in and they go home the same day, so this is performed as an outpatient surgery here in our Ward Institute. And patients go home and you're going to expect to be very bruised and very swollen. Most of my patients take at least 1 week of downtime. Sometimes patients even like to take 2 weeks of downtime where they don't have any obligations or commitments. When I talk about when would you be ready for an event, so say you have a wedding coming up or somebody else's event that you're going to be attending, I like to say give yourself at least 6 to 8 weeks of recovery time in order to feel like you're really looking your best at that time. So what to expect afterward? Patients oftentimes ask us, when are my incisions going to be as inconspicuous as possible? So what that means is that the incision around the ear, if you look at my ear, is going to go here onto the ear and then around the earlobe and back behind the ear. When we talk about how long does it take for that scar to fade, it's going to be about 6 to 8 weeks of some pink tinge to it, and then slowly, if you keep it out of the sun, it should fade to a white linear line. Oftentimes patients can barely see them by about 6 months. Patients oftentimes ask, is a facelift and a neck lift permanent? And what we mean by that is it going to be sustainable? So in 10 years or 15 years, is my face going to look the same right after I had had the facelift? And that's a really hard question because that means that we cannot freeze your face currently in time. What we can do is we can reset the structures and we can put them back to where they used to live, but you're still going to continue to age. So you'll still have gravity, you'll still have aging occur, but if you took a picture of yourself after you had a facelift and compared it to yourself if you didn't get a facelift and then looked about 10 years later, which I know would be impossible to do, then you'd be able to see that you'd still age but still be able to maintain some of those structures. Patients oftentimes ask us about facelift and if they need to have a revision. So a revision facelift may be performed if somebody had a facelift 10 or 15 years ago. And what that means is that they may have had a facelift by a different surgeon 10 or 15 years ago, and then they continued to age. As you continue to age, there is still some descent of that structure. And so patients oftentimes are a good candidate at around that 10 or 15 year mark for an additional facelift or a touch-up. So what to expect? So for that first week, you're going to be very swollen and very bruised. You'll even get swelling around the eyes. And for that first week, we have you in a supportive brace in order to make sure that you have enough support to that skin so that it heals correctly. So here at the Ward Institute, we perform a vertical deep plane facelift. So what does that mean? So the vertical deep plane facelift is different than a SMAS lift, or it's different than maybe something you might have heard of as a weekend lift. And that's because we're going in and vertically changing the structures to be back where they used to be. It's not a pull horizontally, but rather it's a vertical restoration. So the risks of this particular surgery are risk to possibility of forming a hematoma or a blood fluid collection underneath the skin. If you do develop that, you would need to have it drained in order to make sure that the skin and the structures heal appropriately. The other risk to this surgery is risk to the facial nerve. So the nerve for the way the face moves runs in the same plane as the dissection that we do for the vertical deep plane facelift. We're very, very careful in that area, but that is something that we always talk about as a possible risk. A risk of a hematoma or a blood fluid collection underneath the skin is probably less than about 2%. When we talk about the risk to the facial nerve either being a temporary or a permanent injury, it's much less than 1%.